There it goes. And we're going to do a little bit on this side as well. It already popped. Big breath in and blow it out. Big one. Big pop. All right, so we have Ariel and Alex here. We're doing both their videos today, but we're going to spread them out into two different videos. We just shot Alex's, so I'll put that in the link below. But now we're going to work on Ariel, and so you'll have the option to see both of them. So have a seat.
Great to see you all again.
Yeah, watch his video. You got to watch his video. It's a good one. And now it's your turn, okay?
Yes.
Now, excuse me. They're both clients of mine. You've been in a few times, right?
Yes. This is my third one.
Third one, okay. And same with Alex. So if you watch his, you'll see it's not like their first adjustment. There's some familiarity, and we've been working together. And we started working together maybe 3-4 weeks ago, is it? Or
Yes.
Yeah. So we're already seeing a lot of progress.
Yes.
And what have you noticed different from your first
I actually
treatment?
took your advice on the pillow angling for my neck.
Oh, because she's a belly sleeper.
Yes.
Right.
Yes,
So you're trying to get a little pillow under the shoulder so that she's not totally cranking her neck all the time.
Yes.
What happened?
Well, before I always try to sleep on this side, but it was always get stiff, so I have to just switch sides.
Mm-hmm.
But since you told me about the positioning of the pillow, it supported my shoulder and my neck. It was a lot less pressure. Now I was able to sleep actually.
Okay. Let me show you what that is. Maybe you can help me demonstrate that in case people are wondering. So pretend this is a second pillow. It's just a towel. But here, lie on your belly. And this is how she used to sleep. And come around all the way around and see. So it's a lot of rotation. And I was just showing her, instead of turning her into a different type of sleeper, which is very hard to do, I said within the belly category, can we at least get your shoulder up a little bit? So by putting in a little bit of a shoulder lift, now come under here, you'll see there's space here. There's space under here. The shoulder's not flattened and the neck is not as cranked. So it doesn't turn her into a back sleeper, but it takes a lot of pressure off the cervical rotation on belly sleeping. Enough that you felt the difference, right?
Yes. It's a lot more comfortable.
And so it's just a way to modify the belly sleeping where you're doing just one shoulder or the other shoulder, but you still get your belly position that you crave. So let's start face down. You're going to put your nose in here. Thank you for demonstrating that.
No problem.
I feel if we didn't, people would go, well, what do you mean? So at least that way people can see. You know, the very best, which it's really weird because I can only sleep on my back if I'm taking a nap. But other than that, I hardly ever sleep on my back. I'm mostly a side sleeper. But I guess the highest rated would be back sleeping as far as integrity of how your neck would be and your spine without a lot of pillow. Like hotel pillows that are really thick or too much. I use barely anything. I mean, my pillow is not much thicker than this when it's like puffed up, very small. And I try to get it back here so that my head is actually touching the mattress. It's not hovering. And the least pillow that you can use, and mostly just supporting the C curve of your neck, the letter C curve of your neck, the most optimal. The next optimal would be side sleeping. And then the least optimal is belly sleeping. But I don't necessarily tell someone never sleep on your belly again. First of all, it's really hard to redirect ourselves while we're sleeping. We don't have awareness of it. Or we don't want the person's partner to go, honey, wake up, you're on your belly again, and that doesn't create for good relationships. So the next best thing would be to at least make your belly sleeping a little modified so you're not cranking your neck so much, and that's what we were talking about. But let's do some work.
Yes.
Just hopefully people sometimes learn from the channel also. So right here, I'm feeling a heck of a big muscle knot. What is that? Do you feel this one today?
Yes. That's from the laptop.
Yeah, so she said the laptop. So she does a lot of computer time. Don't we all these days, right?
Because I'm a student for medical billing and coding, so I will do a lot of the classwork online.
Yeah. Here, turn this way so we can hear. Say it one more time. Turn your face this way.
well,
So
I was
she's a
saying,
student.
Yes, I'm a student for medical billing and coding, so there's a lot of classwork I have to do, so it's a lot of pressure on my back. I have to readjust myself a few times.
Yeah, it starts to cramp up. I think the unhealthiest time was when I was in school. Like, it's
Yes.
the way my body felt. First of all, I was under that stress. I was always craving the wrong foods. Like, I wanted a little piece of chocolate. I wanted some sugar. I wanted some caffeine.
Me, it's for
Because I was
snacks.
like always under stress and always wanting to push the hours of how much time I could study or put at it. And then the next thing was I'm sitting in chairs all the time. I'm exercising less. And I think I had more body pain at that time than any other time in my life.
Even backpacks mess up your shoulders.
Backpacks,
Yes.
right? And you see kids with backpacks today too. Sometimes their backpack is like, 25% of their body weight. Like a little 8-year-old might have 20 pounds in their backpack.
That's where the hunchback
Yeah.
starts up.
Yeah, they start to get that bad shoulder thing. You feel this right there?
Don't mind the tear if you see it coming out.
Oh,
Oh, I heard a little crack when you
yeah, it just cracked a little bit. So back down to center. Let's do one in here now, okay? So face straight down. And we're going to come down here like this. And we're going to get the spot where we're going to start, which is right there. So let's see. It's a T5. So I'm going to set up here. I'm still holding this spot, so I'm going to come to it in a minute.
It feels very tight.
Yeah, it's very tender there. And then I'm going to switch here like this. I'm going to take a little bit of rotation or torque into it. And now I'm going to have her take a big breath in, focus on my hands, blow it out, and there's one. Let's switch to something else. I'm going to have you lie on your back,
Oh. That was good.
but we got one already, right?
Yes.
I want to do a single arm on you. So I'm going to have you scoot down this way. This hand will stay here.
Okay.
This hand is going to come across to your other shoulder. If I have permission, I'm going to put my hand towards your armpit. So I'm going to come up high into here. My pinky is going to hold her collarbone, her clavicle. So I support the clavicle and I drag it down with my pinky. My other hand, her elbow I'm going to trap in my armpit, like in here. My other hand sneaks under, and inside I'm going like this. I'm creating a tissue pull and compression so I can get a really good set, I hope. So, do you feel me drag this down and create tension across your top of your rib cage?
Yeah, it's like you're kneading dough or something.
Yeah, that's exactly true. So big breath in and blow it out. There it goes. Do you hear it click?
Yeah.
Yeah. So that,
Ooh, feel warmth on my face.
it was intense. So I went in there and got it. There's more.
Yeah.
There's more. Your neck is locked.
Yeah.
Do you want to get that or?
Yes, please.
Okay, so come sit up and have your back to me. And you're going to sit forward, 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 forward. More, right about there. And I'll lower this so your feet touch better. And we're going to do a Occipital Lift next, where I'm going to come under here and lift that. Then we're going to follow that up with the Y strap. So you're going to get like the daily double today. So you're going to turn your head this way. And see how tender it is right there? It hurts, right?
Yes. Yes, it is.
Okay, turn this way. Okay. Big breath in. Blow it out. Got it.
Whew, that was a good breath.
That was it.
It cracked before you even.
Yeah. Did you hear all those
That
though?
was like 4. The first one was 1,
Yeah.
and it was 4 after.
Here, stand up and look towards the camera. How does that feel now?
I feel happy. I feel euphoric.
What'd you hear? It like went up into the head, right? It's a high adjustment.
Yeah. It was like bubble wrap, but more intense.
Are you a little woozy? Or are you okay?
I'm good.
Okay.
Euphoric, but it's nice. It's just the tension shocked me.
So you ready for a little more?
Yes.
All right. I'm gonna have you lie face up. I'm thinking I want to do one more before the Y strap. So let's see. We did that side. I'm going to come under here now and just feel what this is doing. So I already did the left atlantal occipital joint or the occiput area. And what did you say this felt like? You started to say something.
It's just very tiny tension. It's very tiny. It's not as big as my left.
The left was worse, but I think there's some on this side too.
There's very small, but it's there.
So first I'm going to stretch through like this. I'm going to pull.
Oh.
Do you feel it?
Okay. Yeah, I feel it. It feels bigger. We do that. Like it's hiding on my left side still.
There it goes.
It always cracks before the crack.
Yeah.
It's the pre-crack crack.
The anticipation crack. Take a nap.
It relaxes you,
Yeah.
right? It creates a big downshift where our stress level just kind of releases, and a lot of people feel almost sleepy afterwards. Pick up your head. We're going to slide this past your hair, and you're going to have to help me a little bit.
Sure.
Thank you. All right, and drop your head so I can feel the weight of it.
There was a crack.
It just popped again. So she gets these pre-pops before she pops. All right, this time I'm not going to do your ankle, okay?
Okay.
Big breath in and blow it out.
Ooh. It was more towards the cranial.
Where?
Up here.
At the very top? Good. And that's where we've been working. We were trying to open that compression. And I think a lot of that is you tilting your head into that laptop.
Yeah, it is. My man always tells me I have
Yeah.
to change my position.
I like people to get their laptops higher. I'm into getting either books under your laptop, if necessary, get a second keyboard and mouse, so your laptop could at least be at eye level, and you're only really using your laptop as a monitor. It would take you buying another keyboard, but I've seen keyboards for a very low price on Amazon, a separate mouse, and that way you're lifting it up, and your eye line is forward, not down. The down position is exactly where she has her compression, which is right here, the atlantal occipital joint, the base of the skull and the top of the atlas. And it goes along with her lifestyle, right, which now is just a lot of studying as a student, a lot of time in the computer, a lot of time in books. Here, scoot down towards me. Another way to go is you could use your laptop for your keyboard and mirror up to a second monitor. So you'd have another monitor like this, and your laptop would have to have an HDMI cable and lift it up. And then you push the screen up to the mirrored monitor, but that way your neck doesn't hurt all day. Now, it's not necessary if you're just going to be at a coffee shop for half an hour playing on your laptop, but if you're working 6, 8, 10 hours a day on your laptop, you're going to really hurt your neck. So that might be worth modifying it or creating a better setup so you're not always in pain. And we talk a lot about that when people come in during normal office hours, but I like to share that sometimes on YouTube as well. So now I'm going to come in and do your upper thoracics, okay? Big breath in here. Turn your face all the way towards Alex over there. Good. And let's do another one. Look all the way towards him. And those are fine. Now lie on your side facing me this way. Those are intense though, right?
It took breath out of me, but it helped.
All right, good. I mean, not good that it took your breath away, but good that it helped.
Yeah.
This work, I would say as far as chiropractors go, I'm much more intense or heavy than a lot. Not necessarily on YouTube, but in any city where you're from, you're going to find chiropractors that work much lighter than me. So when I'm working on someone, they might feel like the pain of the intensity of the way I work, but hopefully they're feeling the therapeutic effect as well.
Oh, yeah.
So the therapeutic effect is the relief that you get.
Yeah.
But while I'm in on the muscle or have my elbow in someone's back doesn't necessarily feel good
No.
in that moment. So let's do the lower back next.
Sure.
And we're going to come right in here. You already feel it.
Yeah.
So this is L5. Got it.
Pre-pop too.
Yeah. And then it popped even more, right? So come on all the way this way. Bring this leg up like this. And we're going to do a little bit on this side as well.
Oh, pop again.
It already popped. Big breath in and blow it out. Big one. Big, big pop. All right. Lie on your back when you're ready.
I feel like a noodle.
A needle?
A noodle.
A noodle. A noodle would be better than a needle.
Yeah.
I mean, at this moment.
At this one, yes.
So I'm going to come in and do a little bit with the ankle. That one's fine. That one popped. All right. These are all good. A little with the toes. All right. I think that's it for you, my friend.
Yes.
Come stand here and just see how you feel. Roll your shoulders a few times and just talk to us.
I was actually working out my waistline at the gym, so I was a lot of tension there. Plus the hunching of the laptop.
Yeah.
This is actually the position.
So
Of the laptop.
see if you can improve it, okay?
Yeah.
It might take a separate keyboard, a separate mouse, but since that's not going to change anytime soon, meaning you're going to be a student for a while, right? And putting
One more
long
month.
hours. But then you still have to work online, right?
Yes.
So your life is going to be on computers for a while.
Yeah, I'm gonna try to
Yeah.
take your advice.
Because
and
insurance coding, you have to be touching a computer, right?
a lot, and
Yeah.
a lot of the books, and
Yeah.
looking down.
So try to optimize your workstation. All right, thank you for watching, and don't forget to watch both of their videos if you'd like to see them. Okay, thanks.
Thank you
Okay.
so much.
Bye bye. And we're gonna do a little bit on this side as well. It already popped. Big breath in and blow it out. Big one. Big, big pop.